Why does enlarged prostate size not equal symptoms? Imagine two men with similarly enlarged prostates. One experiences frequent urination and difficulty starting to urinate, while the other has no symptoms at all. Why is that? The answer lies in the complex nature of how the prostate affects urinary function. When the prostate enlarges, it can press on the tube that carries urine out of the bladder, called the urethra. But how much it causes problems depends not just on size, but also on where and how it grows. Some prostates grow outward away from the urethra, causing little to no blockage. Others grow inward, pressing directly on the urethra and causing more noticeable symptoms. So, a large prostate doesn't automatically mean trouble. Another important factor is the muscle tone within the prostate and the bladder neck. Even a smaller prostate can cause significant symptoms if the muscles are tight or overactive. Conversely, a larger prostate with relaxed muscles might cause fewer issues. This dynamic component explains why some men with big prostates feel fine, while others with smaller enlargements struggle with urination. Bladder health also plays a key role. Over time, the bladder muscles can become overactive or weakened, especially if there's been ongoing obstruction. This can lead to symptoms like urgency or incontinence, which may not directly relate to the size of the prostate. Some men with large prostates have a well-functioning bladder and experience few symptoms, while others with smaller enlargements may have bladder problems causing more discomfort. Other factors like medications, caffeine, alcohol, and overall health can influence symptoms too. For example, certain drugs or drinks can irritate the bladder or worsen urinary issues, regardless of prostate size. It's also important to distinguish benign prostatic hyperplasia, or BPH, from prostate cancer. BPH is a non-cancerous enlargement that affects different parts of the prostate than cancer does. Having an enlarged prostate does not mean you are at higher risk for prostate cancer. Men can have both conditions separately or together, but one does not automatically lead to the other. In summary, the size of the prostate alone does not determine how severe symptoms will be. The shape, location, muscle tone, bladder health, and other personal factors all influence how a man experiences urinary issues. That's why doctors look at the whole picture, not just prostate size, when diagnosing and treating. If you have urinary symptoms, it's important to see a healthcare professional for a proper evaluation. They can help identify the cause and suggest the best approach for your individual situation.